In this video, we will talk about the next bone which belongs to the neurocranium as the temporal bone, the most difficult bone of the skull and maybe in the whole body, because it has a lot of landmarks, complicated relationship with other bones and with different parts of itself. This is the parietal bone of neurocranium, located in lateral aspect of the skull, forming the lateral wall of the brain box. Has several parts, which form complicated relationship in the temporal bone. Has three parts. As all neurocranial bones, it has squamous part. It has petrous part, which consists of two, pyramid and mastoidal process. And it has small part which form the tympanic cavity. It is tympanic part, is which related medially with petrous part, posteriorly with mastoid process, and superiorly with squamous part. Using of all parts form the main meatus of this bone, which call it external acoustic meatus, which formed by the mostly all parts of the temporal bone, from the squamous, petrous, and tympanic parts. Okay, first division, squamous part. On the squamous part, we have surfaces. As external surface, yes, there is external surface. This external surface. And internal surface. Also borders of the squamous part. Anteriorly, it related with sphenoidal bone, that call it as sphenoidal border of the squamous part of temporal bone, margo sphenoidalis, pars squamosa. Superiorly, it related with parietal bone and call it parietal border of squamous part of sphenoidal bone. And small amount from behind, which directed on the mastoidal process, located on mastoidal process, base of mastoidal process, has name as parietal border. Means here you can find the parietal angle, which call it as mastoidal angle, has fusion with this bone. Okay, next part, it is mastoidal, has external surface and small amount of internal surface. Yes, is of petrous part. Also petrous part has pyramid. Pyramid has three walls and three borders. Anterior surface, posterior surface, and inferior surface. Inferior surface on this division. Again, superior, posterior, inferior. Borders, call it a superior border, inferior border, and small amount of anterior border. Yes, we have anterior surface, anterior border, posterior surface, and posterior border. But we have against of it, we have superior border, yes, which form the triangular shape of triangular prism of the pyramid, triangular pyramid of petrous part. Yes, later we'll talk about it more. Also, tympanic part has no borders, because all borders and relationship of tympanic part related with squamous and petrous part. Okay, next. The squamous part has basement which form the counterforce of bony tissues which form process, yes, which call it zygomatic process, which laterally projected and continues to the zygomatic bone to form zygomatic arch. Below of it, between the squamous part and tympanic part, we have fossa, which call it mandibular fossa. The head of the mandible will be joined to this fossa to form temporomandibular joint. Mastoidal process has base and apex. Yes. On internal surface, it has shallow, which form the groove for the sigmoidal sinus. Yes, and on the petrous part, we have more details to describe. First of all, pyramidal part. On the anterior border, we have step-by-step direction from lateral to medial. First, it's located tegment tympani. Next to it, it is arcuate eminence on the tegment tympani, and on the border of it, it is groove for the superior petrous sinus. Here is located groove for the superior petrous sinus. I'm supposed to find here venous sinus. I will show you. The venous sinus will project here. Yes, you see, here is the superior petrous sinus and inferior petrous sinus, also connected with sigmoidal sinus. Yes, sigmoidal sinus, superior petrous sinus, and inferior petrous sinus. All of these sinuses has grooves. Yes, on anterior or on the apex of the petrous part, you can see the impression for the trigeminal nerve. Next one is two grooves for the greater and lesser petrosal nerve, which projected above of the two main canals, carotid canal. I will add the carotid artery to show you the carotid canal. Yes, the carotid artery passes through the temporal bone. Yes, and above it you can find the trigeminal nerve impression, greater and lesser petrosal nerve grooves. Above of the apex of pyramis and above of the canal for the carotid artery. Okay, next one. Next structure, which is located on the pyramid, can be found on the posterior surface of the pyramid. It is subarcuate fossa and two main fossas, it is aqueductus vestibuli and aqueductus cochlei. Also, I will turn back for the parts because these parts will show you the openings of some canals. First of all, this one is internal acoustic meatus. The facial nerve and vestibulocochlear nerve pass through this opening. Yes, also you can see here the greater petrosal and lesser petrosal, openings. hiatus nervi petrosi majoris et minoris. Okay, and on the inferior surface of this bone, you can find first and found the opening for the carotid artery, external meatus canalis caroticus externus. Next one, it is jugular notch. Yes, jugular notch with jugular. There is jugular notch with jugular fossa and septum with and crest, jugular crest, which separate these two structures on two. Yes, which form the two small fossa, smaller and larger fossa. Below of it, you can find the groove for the occipital artery on the inferior surface of petrous part. Between these structures, you can find the small and very little opening, here, which has name as fossula petrosa. Yes, fossula petrosa here. Okay. What we can find on others divisions of the temporal bone? Tympanic cavity and tympanic bone, a tympanic part of the temporal bone, has external acoustic meatus. From this part, you can see the projected downward and slightly to the front, the styloid process pointed inferiorly as on the inferior aspect of the temporal bone. Behind of it, between the styloid and mastoidal process, you can see the stylomastoidal foramen. Stylomastoidal foramen on inferior surface of the temporal bone. The facial nerve passes through this foramen. Also, this styloid process is the site of origin of a number of muscles, ligaments, which relate with hyoid bone later, and is the sign of development of speech in human. Means if the skull has no prominent, is not any styloid process, or this styloid process not developed as well, means the person or maybe animal has absence, or the speech of this person is not developed as well. Okay. Also, what we can find on the mastoidal process. On mastoidal process can be found the mastoidal foramens from external and internal side, which form the mastoidal canals. That is the place of passing of arteries which pass through these openings. Okay, that was the main features and landmarks which you can find on the temporal bone. As the temporal bone is most complicated in this site. I doesn't name any more landmarks because you can find more of them in the atlases, in the books, and this video will become as like the list of the information. As I showed you the main, and probably try to show to you relationship with different arteries. For example, relationship with the petrosal artery, and maybe now with medial meningeal artery. You see the medial meningeal artery passed near through the styloid process of sphenoidal bone to the squama of the temporal bone, and you see the groove inside of this part of temporal bone. Also, important part in the question of the canals. First, it is first canal. It has on three main canals. Some of people count until 13 canals, but main of them still 3. First of this, first of these canals is carotid. It's S-shaped canal which pass through the temporal bone. Yes, pass through the temporal bone in S-shaped. Yes, pass through the external opening to internal in S-shaped, from inferior surface of the petrous part to the apex of the pyramid, together with yes, together with this canal, you can see you can find the neural plexus and venous plexus of carotid canal. The first canal is carotid canal. Okay, next canal. The nightmare of all students and all doctors, it is facial nerve canal. I have to do some long procedure to perform it, that I need to add the nervous system. Then I have to add the facial nerve. Choose the multiple selection with the temporal bone. Temporal bone and facial nerve. Okay. On this view, you can see how the facial nerve starts from somewhere, from the some point of the brainstem. Is not important information now for you, but it has, I will show you, like fade. I will fade the temporal bone and you will see. It start, okay, facial nerve. There is facial nerve. Okay. Facial nerve start from the brainstem and pass to the internal acoustic meatus. Here it is, internal acoustic meatus. Yes. And give some main branches. It lay on the inferior wall of the internal acoustic meatus and this internal acoustic meatus separated by septum on two halves. Yes, inside of this canal, the facial nerve form the some bad with this program now. It's loaded. Okay, I need to turn back the temporal bone and the facial nerve again. Temporal bone and facial nerve. There is facial nerve. Okay, again. Facial canal starts from the internal acoustic meatus. Yes, goes directly. I need to. Yes, goes directly to the lateral aspect of the pyramis. Yes, you see. This lateral aspect of the pyramid make a genus, make a knee, yes, bend and direct laterally and downward, pass out through the styloid foramen, stylomastoid foramen, yes, and pass out and give a lot of branches. But the main features, first, on the place where it make a loop, make a genus, it formed the, as you see, it formed the genus. On the place it formed the first canal, like subdivision of facial canal. Subdivision of facial canal. As here, it is greater petrosal nerve. You hear it before that greater petrosal nerve has some groove on the surface of the petrous bone here. Relationship with it. Later, this facial canal gives some branch on the middle aspect of the tympanic cavity, pass on the wall of the tympanic cavity and give the chorda tympani, and it calls tympanic canal through the tympanic membrane and communicate with the petrosquamous fissure. Petrosquamous fissure. Petrotympanic and petrosquamous fissure. Petrosquamous fissure. Pass through the petrosquamous fissure here. Yes. And last side it is passing through the all other division of the facial nerve pass through the stylomastoid foramen. That means the facial canals start from the internal acoustic meatus, pass again laterally or parallel perpendicular to the petrous part of the temporal bone, make a genus directed to the side and downward, and pass out through the stylomastoid foramen. That was the temporal bone and facial nerve relationship, and relationship with petrous nerve, and relationship with tympanic cord. Okay, I will hide the cranial nerves, leave the temporal bone, and add the respiratory system, because you have to know about the eustachian tube. Yes, this tube this tube, I will choose it in multi-selection, the pharyngeal tube, temporal bone, some aspect of pharynx. Some aspect of pharynx, we'll add it. Hide others. We have the upper air passage, some aspect of it, and eustachian tube. There is eustachian tube which start from musculotubular canal. Musculotubular canal is served by number of canals of temporal bone, which has two parts: semicanal for the muscle and semicanal for the tube. Latin name of this, it is Canalis musculotubarius and semicanalis muscularis, semicanalis tubularis, pars tubularis. This part, tubular part, consists by the cartilage part of eustachian tube, which communicate tympanic cavity, yes, which communicate tympanic cavity with the nasopharynx to equilibrium, to equality of pressure quality of pressure inside the tympanic cavity. Okay. Also, together with this tube, you can see this muscle, small muscle. I will fade others. Is this muscle? You see, starts from the tympanic cavity inside and pass to the eustachian tube. Yes, and form the second part of this canal. Yes, this canal starts from the tympanic cavity and go straightly parallelly of the axis of pyramid. Yes, contains the two structures: muscle, musculus tensor tympani, and eustachian tube. There is main structures of the main canals of the tympanic bone. First, carotid, musculotubal, and facial. There is three main canals. More information about the temporal bone you can find in different sources. If you want to hear more, you can ask me on the lessons.